Randy! What's up, bud? Oh, nothing, just gonna talk about bilirubin or something. Oh yeah, well why don't I tell you all about it? Bilirubin can be an indicator of many diseases, and therefore, it is an important concept to understand. Bilirubin is a collection of bile pigments that are formed from the breakdown of heme and red blood cells. This is called unconjugated bilirubin. Unconjugated bilirubin is unable to be filtered by the kidneys and indicates that a disease is present. The other type, conjugated bilirubin, is formed during a biliary obstruction. High levels of conjugated bilirubin reveal a disease's location within the liver or biliary tract. A significant finding of accumulated bilirubin is jaundice, or a yellowing of the skin. The collection of bilirubin that occurs within the blood results in possible yellowing of the sclera and skin, clay-colored stools, tea-colored urine, pruritus, fatigue, and anorexia. Cholelithiasis, or gallstones, is a common disorder where patients usually present with jaundice, resulting from an obstruction of the biliary tract. Bile becomes saturated with cholesterol, forms crystals, which then form stones, causing an obstruction. Clinical manifestations include spasm pain in the upper epigastric region, which radiates to the back as the stone tries to pass, jaundice from the obstruction of the common duct, and nausea and vomiting. Hepatitis is another condition that presents with jaundice. Hepatocytes in the liver change due to the immune response, causing inflammation of the liver with necrosis. Phagocytes then enlarge, resulting in vascular tissue inflammation and damaged hepatic tissues. The inflammation causes red blood cell destruction, leading to anemia and jaundice. Hepatitis can also present early with flu-like symptoms, followed by abdominal pain, fever, dark urine, clay-colored stools, bleeding, and irritability. Hepatitis can be a constant threat since different types are transmitted via separate routes. Hepatitis A, E, F, and G can all be contracted through unsanitary water or improper food handling, whereas hepatitis B, C, and D are often seen with dirty, reused needles, blood products, and individuals with risky sexual behaviors. Other conditions that present with high bilirubin levels are metastatic cancer to the liver and pancreatic cancer. Jaundice, however, is common and expected in infants a few days following birth. While in the uterus, the infant's hemoglobin differs from the hemoglobin individuals have when they are outside the womb. When the infant is born, its body starts to adapt to its surroundings, creating the hemoglobin required to live outside the uterus. This causes the red blood cells containing the infant's hemoglobin to hemolyze. Not only do the red blood cells hemolyze, but the infant's liver is too immature to properly eliminate the bilirubin, further increasing the serum bilirubin. Neonatal jaundice is expected beginning the second day and slowly clears over time. Bilirubin affects each age group and is an important laboratory value to understand.